Hi, I'm Dr. Jonas Leibowitz, an endocrinologist with almost 30 years experience, here to talk to you on behalf of My Diabetes Doc about prediabetes. To me, prediabetes is the most important part of the lifespan of a diabetic patient. Why? Because you don't have diabetes yet. And if I wanted to really help someone not have diabetes, it would be act on it when you find out that you have prediabetes. So the number is kind of the number diagnosis is made by some of the same tests we use for diabetes. So the hemoglobin A1C test, which represents a percentage of sugar stuck to the hemoglobin or blood molecule, would be 5.7 to 6.4. The fasting sugar level would be 100 to 125. And a 2-hour post-meal sugar from 2 hours after you start the meal would be 140 to 199. Some guidelines call that postprandial or post-meal hyperglycemia and use the glucose tolerance test, 2-hour test of 140 to 199 for the diagnosis of prediabetes. But again, prediabetes is exactly what it sounds like. What does it mean? It means that if you're at risk, perhaps because you have a sedentary lifestyle, you put on some weight, you're not as active, you have a family history of diabetes, you've had pregnancy diabetes, you have polycystic ovarian syndrome, perhaps you're a smoker, all of these things put you at risk for diabetes. And you're now given a warning sign. You're being told your sugar's too high, you're not a diabetic yet, but you're not normal anymore. And that's really the time for intervention, that's really the time for action. Because we know that your body is churning out insulin in higher amounts to try to get that sugar down so you don't become a diabetic. And just like a tire wears out its tread over time, your pancreas may also wear out its ability to produce insulin, and at that time you become a diabetic. This process is often a 10-year process, and believe it or not, a third of American adults are sitting in this prediabetes range, and they now have the ability to intervene. Simple intervention without medications can include exercise, 150 minutes a week divided up in the course of the week, perhaps with several sessions of strength training, or dietary changes, cutting out on higher carbohydrate foods or higher sugary foods, using your plate method to use lean proteins on the plate or leafy greens or vegetables as well, and overall just trying to cut back. And it's thought that even a modest weight loss of 5% may be able to delay the development of diabetes. We also learned that some patients who are not yet diabetic, but are pre-diabetic, already start to have cardiovascular disease and strokes before they became diabetic. So it really is a risky state to be in because it's moving towards diabetes, and it may even be the beginning of the atherosclerotic process.